This is lab 15 on the dog specimen. So today you will be skinning part of your hind end. So you basically are just skinning the cranial thigh. So you're making an incision from the medial part of the thigh up the cranial aspect just to expose that cranial aspect of the thigh and the rest of the abdomen. So you're just taking that back as another piece of skin. Then for today we'll start on the belly. So here's the ventral view, and you're looking by the midline. So midline would be right here. And you're looking for some vessels coming out right in this inguinal area. So you also want to look for this superficial inguinal lymph node. So that can kind of be a marker. Once you find that, you know where you're supposed to be digging. And once you dig down in the fascia, just be careful to do blunt dissection and not use a lot of scalpel, because you will cut these little vessels and nerves in here. So you're looking for the external pudendal artery coming out, which will be down in there. So the artery is right here. So external pudendal artery coming out of the superficial inguinal ring there. And then that will split into one larger continuation and then a small caudally running continuation, which sometimes gets broken and sometimes isn't seen. So external pudendal artery here, then caudal superficial epigastric is this artery, the continuation going up the belly. And then in this case we have a female, so this will be the cranial labial artery running here. If it was a male, it would be cranial scrotal artery. So cranial labial here, caudal superficial epigastric there, both coming off of external pudendal artery there. Then you also have an external pudendal vein coming out at that same place. So right here is the vein coming up, and you see it kind of follows along with the artery and branches there. So external pudendal vein. And then you have a genitofemoral nerve that's also a little difficult to find. So if you look for a nerve kind of coming out, running along with the artery and the vein, a lot of times it's actually attached to or sandwiched right onto the vein. So sometimes you just have to peel it away. But here's that genitofemoral nerve coming out with those vessels there. Okay, then we're going to move on to the lateral side. I'm just going to tip the dog this way. So on the lateral side, you're looking again for some branches that you see coming out. So just cranial to the thigh is where I start. The book has you starting with the cranial abdominal, which is just caudal to the ribs, but I find that to be really difficult. So I start with this lateral cutaneous femoral nerve as my starting point for this section. So I find this going to the cranial aspect of the thigh and then kind of work backwards from there. So this would be the lateral cutaneous femoral nerve. And where that's coming out, here you have to cut some of your abdominals. So you just kind of cut along the wall of the abdominals and reflect them back. And you'll have the lateral cutaneous femoral right here, and coming out with that will be the deep circumflex iliac artery and vein in here. So there we go. So the artery is in the forceps and the vein is this big one right here. So deep circumflex iliac artery and vein coming out there. L4, so then you move back and look for an L3. So here, this one is the next one. It looks like coming off right there. And so I just kind of dig down in between where the abdominals are covering and find where that's coming from. So that would be L3, or the ilioinguinal nerve. And then you keep moving back and you'll find another one. So this would be ventral branch of L2, or the caudal iliohypogastric nerve right there. And then you get to the ventral branch of the L1. So then that should be this one right here. but that will be the ventral branch of L1, or the cranial-iliohypogastric nerve. And that's where you'll see your cranial abdominal artery that the book was referring to coming out just behind the ribs. So that will be coming out with that ventral branch of L1, cranial abdominal artery. Then we also have a few terms, especially for the male, that are important today. I'll flip this is a female, so we're going to go back to the ventral aspect here, just to see the vaginal process, which we already saw on the other side. So we did identify it previously, but here, coming out of your superficial inguinal ring, which would be there, coming out is this fatty process, and that's the vaginal process in the female. So in the male, this is where you would have your spermatic cord coming out, and you'll have a bunch of things to identify on there. But for the female, you're just looking for this vaginal process here. And that travels through the inguinal canal, which we also previously mentioned, but that's that little space between the deep inguinal ring and the superficial inguinal ring, is that inguinal canal. This is an addition to Lab 15, so this is a male dog. So we're going to cover just the male structures that we didn't have on the other dog. So here we're starting down by the superficial inguinal ring right here, and you can see the spermatic cord coming out. So that's exiting that ring right here and traveling down to the testis. So here was the scrotum. So that's just the skin covering the testes, and we've cut that open with an incision and opened that all the way up so we can get in there and travel with the spermatic cord all the way down to the testis. In your spermatic cord is covered with spermatic fascia, which is the outermost covering. So that's going to be the outer part, which some of it has been removed here as I've dissected. But here we have the cremaster muscle that you can see. So that was the caudal edge of internal abdominal oblique, and so that's just that little slip of muscle traveling along the spermatic cord there. So vaginal process in the female, you remember, was that fatty process, but vaginal process in the male is actually equal to the vaginal tunic. So you have spermatic fascia on the outside, then vaginal tunic is the next layer. So here I've actually cut open the vaginal tunic, and this would be the parietal vaginal tunic. And the visceral is covering the things inside. So visceral is actually adhered to the structures inside. So parietal's been cut open all the way down. So you'll want to do that and see inside. So now we can open this up and pull apart the different pieces. So right here we have ductus deferens, this whitish part here, and along with that you have a deferent artery and vein. So that would be these two right here. You can't tell really which is which by color, but there is a deferent artery and a deferent vein. Then here you have testicular artery kind of running through there. You see little pieces of red running through, and that's the artery. And then the vein actually has this pampiniform plexus, which is all of this area, this dark colored area is the vein, but it's also called the pampiniform plexus in this area. So testicular artery and vein. Attaching to your testicular artery and vein is mesorchium, which would be this part. And then we have mesoductus deferens is the part attaching to the ductus deferens and deferent artery and vein. So that's going to be this connective tissue here. There's also a figure in your book, figure 4-5, that's really helpful to understand that concept. So take a look at that. And then we'll move down to the testis itself. So here I've opened up that vaginal tunic. Here we have the testis, and here on the lateral side you'll find the epididymis. And the epididymis will have the head, so head goes up towards the head, body, And then the tail of the epididymis will be right back here. So tail goes towards the dog's tail. So if you remember that, you'll always be oriented correctly. So epididymis here, and then we have a couple of little ligaments. If I open this up all the way, so here on the tail of the epididymis, you have the ligament of the tail of the epididymis here, so right there where the probe is. And then you also have the proper ligament of the testis, which is right here. So connecting that epididymis to the testis proper ligament. And figure 4-7 in your book is also helpful for some of these structures as well.